I'm Michelle Griego in the CBSN Denver studio. September is Suicide Prevention Awareness Month, and it's a topic that's tough to talk about, but crucial to address, especially now. According to the CDC, trips to the ER due to suicide attempts increased during the pandemic. And here now is Whitney Kearney, a licensed professional counselor with the Health One Behavioral Health and Wellness Center. And Whitney, it's so good to see you. First, we know the pandemic has been so tough on everyone. What's your advice to anyone who is struggling right now?
Hi, thank you so much for having me here today. We certainly are seeing an increase in symptoms of anxiety and depression with individuals at large, even individuals that maybe have never experienced these challenges before. We want to encourage individuals that are struggling right now to really engage in social interactions, talk to those trusted people in their life about what they're feeling, what they're experiencing, and be intentional about maintaining healthy habits, whether that's movement, nutrition, sleep hygiene, being cognizant that they're doing the best they can to take care of themselves.
It's tough to even think about this, but suicide rates among children are rising at alarming rates. Are there any warning signs parents should keep an eye out for?
Yeah, I think there's certainly things that parents can keep an eye out for and things that we can encourage them to do to try to keep tabs on this. As you mentioned, for some people, it's a difficult subject to talk about or address, but we want to encourage parents to look out for individuals that maybe aren't engaging in activities that they used to enjoy, experiencing hopelessness, social withdrawal from friends or close loved ones, also maybe increased crying or mood swings, agitation are all key factors to keep in mind. In addition, I would encourage parents to have an open dialogue. Check in with your kiddos. How are you feeling? How are you doing? Create a platform that feels safe to talk about feelings and emotions.
Yeah, it's always good to check in. Depression, we know, is a struggle for people of all ages. So for adults, are there other warning signs or risk factors we should know about?
There are certainly things that overlap with what I just identified. Sometimes adults can be a little more thoughtful in not engaging in future planning or future orientation if they're hesitant to make plans with you. That's certainly something to keep an eye out for. We want to be aware of any access to lethal means, and if we're concerned about someone, we're encouraging them to limit access or remove access to some of those lethal opportunities that could be used in an impulsive moment. And again, just decrease in social engagement or withdraw from those social relationships is really a key factor as well.
So what if someone is having suicidal thoughts? What resources are out there for those people?
Yeah, there's a lot of resources available. Certainly, we want to encourage individuals to talk to someone about how they're feeling. Certainly, a first line that sometimes is easiest to address is a close friend or family member, but eventually talking to a qualified professional, individual therapist, or group therapy program, those are all highly encouraged. And if it's a dire moment of need, there are many crisis resources available in the community as well, whether that's a walk-in center or a text line or calling into a phone number to talk to an anonymous clinician to obtain the support that's needed.
All really good information to know. Whitney Kearney, thank you so much. And of course, we'll put all of these suicide prevention resources on our website, cbsdenver.com. Thank you so much. Thanks. It was great talking to you.
Thank you so much for your time.